This is Tasso Island. Tasso lies at the heart of one of Sierra Leone's most precious islands, the Sierra Leone Ocean Estuary. With a population of about 6,000, accessing quality health care has been a long-drawn challenge. For Aged Awakamara, this is no longer a challenge, but a pandemic because the lives of pregnant young women are on the line.
We want the hospital, let them build for you to find hospital.
We want a hospital to be built because the one we have is hockey buts with inadequate nurses. So if there are more nurses or doctors, then it will be a reduction of our suffering for quality medication attention.
If the nurses and they go down, they left.
Pregnant women face significant hardships when access to medical attention is limited, including increased risk of pregnancy complications, poor maternal and infant health outcomes, and emotional distress.
As we go to the big hospital, government hospital.
Whenever we need medical attention, we have to go all the way to a government hospital in Lungi. When we go there, the nurses will say they haven't received any supplies, so we have to go to town and buy medicines, just like they prescribe. The nurses are not always here, and sometimes when pregnant women want to give birth, they do so at home.
The nurse in charge of the facility noted inadequate supplies and personnel are the key issues for the low quality.
I'm not the only staff nurse with the work now, and I'll get other staff nurse who will left for take care of the health facility.
I am the only staff nurse at this center, which is why when I go on meetings or trainings, the center becomes empty. We also don't have adequate medications, and when we refer them to other medical facilities, they don't have enough money to buy nor on board a boat. So these are all the challenges I face.
One patient, way for say for refine a year, some they not get that money for pay for fuel or boat for both the other facility, and the finance so difficult. So myself na big challenge for me.
A sense of relief was felt as Rotaract Club of Freetown visited the community to offer screening and medical outreach to the young and aged. The beautiful voices of these residents, conveying their excitement in the Tamil language, showed a sense of relief receiving the Rotaractors.
To screen for three main things. One is hepatitis, diabetes, and hypertension. We'll be able to provide free screening for over 500 people.
Beneficiary, they are happy, first of all, for the medical outreach, because we all know here is an island, and not all the time they will get this kind of opportunities for people coming out from the mainland to get them here. So they were very happy to be here, and before we are even at the site, they were already here, they have been registered, and they were waiting for us.
With great sense of appreciation from a community that depends on basic farming and fishing, their cries for good health care grows louder as the call on authorities to respond sooner. Sahr Solomon Yomba, AYV News, Tasso Island.